Chair Mona Sanderson, Vice Chair and members of the committee. I'm Charlie Swanson, and I am a member of Healthcare for All Oregon from Eugene. I'm part of a team that helped to write Senate Bill 631, which is a revision of a bill that was introduced in the House in the 2013 session. And it establishes universal, comprehensive, publicly funded health care in Oregon. I'm going to give an overview of what the problem is, how this bill will help, and what are the next steps. A major problem is that healthcare costs have been rising rapidly for a long time. This chart shows healthcare costs projected for a decade into the future, and with that projection from 1991 to 2025, we expect that healthcare costs will have risen 50% more than the Oregon economy. All categories of health care have risen faster than inflation, than wages, and than per capita income. Prescription drugs have risen faster than anything else, but healthcare administration has also risen very rapidly. This increase in healthcare costs has created hardships and disasters for individuals and families. It's estimated that at least 600 Oregonians die, and at least 8,000 Oregonians go bankrupt each year due to economic barriers to health care. This chart shows why being covered, that is, having insurance, is not enough. This shows the percentage of households that are unable to pay the rising deductibles and co-pays. It's especially hard for those who are slightly above poverty level but not quite eligible for the Oregon Health Plan. These rising costs have also created hardships for state agencies, for government, because a rising share of all spending goes towards health care. There's less left for everything else. It's also impacted private employers. Even with employees picking up a larger share of their health care costs, the rising cost to business has meant their profitability has shrunk and they have less money to reinvest. Oregon's been a leader in moving towards more universal coverage and trying to control health care costs for some time. This act will continue Oregon's leadership. The act will actually need more stakeholder input to define a system that's ready for implementation. The purpose of the act, and I'll just read the purpose, is to ensure access to comprehensive, quality, patient-centered, and affordable, publicly funded health care for all Oregonians, to improve population health, and to control the cost of health care for the benefit of individuals, families, business, and society. The bill will cover all people residing in Oregon or working in Oregon. All people who are in Oregon are currently covered for acute emergency room care. That's a legal, ethical, and moral imperative. But it's also expensive. This bill would broaden coverage to other sorts of care. It could prevent many of these emergency room visits and better maintain health. A major theme of this bill is to simplify administration. It will do this because it will be universal. It will cover everybody in Oregon. It will cover all medically necessary services, so it's comprehensive. It will be single payer. There will be the same payments for the same services. There will be no copays and deductibles. We'll also have flexible payment systems, which are may be tailored to each provider to best meet the needs of the providers, the patients, and the system. These payment systems might include global budgets, fee-for-service, and other transparent and fair systems as needed. And we expect that these will be able to create the best incentives for appropriate and efficient care. This chart speaks for itself. In red is the number of healthcare administrators, the growth in healthcare administration, and in blue the number of physicians, the growth in physicians. The number of administrators has gone 15 times more in the last 3 decades than the number of physicians. In general, administrative simplicity will lead to greater equity. For this bill, there will be all residents will be covered equally and all services will be covered equitably. Providers will be able to treat all patients the same and know that their services are covered. There will be no difference between those covered by private insurance, by Medicare, or by the Oregon Health Plan. This bill also addresses an issue with urban and rural equity. It defines regional planning boards to continually look at the conflict between providing sufficient services in rural areas and controlling system cost. It largely replaces the Certificates of Need program. There may be other issues, geographically related issues, that can be addressed by the regional planning boards. Usually, increased equity will also lead to increased efficiency and lower costs. But sometimes, as in this case, the increased equity will actually lead to slightly higher costs, but it's still worth it. Oregon will not be alone. Every other industrialized country in the world has a system similar to this bill. There are many other states that are moving in this direction also. What are the next steps? In this session, the most important step to moving towards controlling healthcare costs is to fund the study of healthcare financing that was authorized in the 2013 session, in particular to pass House Bill 2828 with funding. This study will give us guidance to improving and completing the plan. We'll use the best ideas from this bill, from the 2011 bill that established coordinated care organizations. We'll use information from successful systems worldwide, and we'll engage stakeholders and experts. What can we learn from other countries? Every other country in the world spends less on health care than the U.S. The U.S. is over here in red, a lot less than we do. Most other countries have better results than the U.S. This shows female life expectancy at birth with the U.S. in red. Other markers of healthcare effectiveness would show similar results. What are the benefits of a system as described in this bill? There will be sufficient administrative savings to extend comprehensive services to all. This will greatly improve equity and affordability. The administrative simplicity will help to detect and reduce fraud. We can expand the Oregon prescription drug program to all pharmaceutical purchases in Oregon. This will deal with the portion of healthcare with the largest cost increases. The economic barriers to healthcare leading to death and bankruptcy will be eliminated. We expect that the increased competitiveness of Oregon businesses will lead to 50,000 new jobs, which will more than offset the loss due to decreased healthcare administration. The improved provider payment systems can shift the focus of care toward health promotion, primary care, and prevention, and away from less effective, more expensive later stage treatments. How will this be financed? The healthcare financing study will help to determine that, and the financing details will need input from many stakeholders. We expect the study to show that there is a better financing scheme than currently exists. And we also expect that most people in Oregon will pay less when a universal system is implemented than they would without such a system.
Imagine a future with no healthcare bills. No confusing plans or restrictive networks. It'll be simple. One quality plan for all of us, for our whole lives. We'll be free to have the job we want, not just the job that provides insurance. No! We'll be free to see our own doctors and receive the best care for our families when we need it, not just when we can afford it. We won't have to put off seeing the doctor and risk getting sicker. We'll be free to have the care our doctors advise without worrying how we're going to pay. Freedom from financial worry. Freedom to be healthy. Join thousands of Oregon physicians and patients who are working to make it happen. Help us. We can make this real right here in Oregon. Now.
So in summary, the most important action in this session is to continue moving towards healthcare that provides better service with lower cost, is to pass House Bill 2828 with funding, the study bill. We ask that the state and other stakeholders continue to help with planning beyond the study. We can explore negotiations for federal waivers, certifications, and permissions that will be needed to implement this plan. We can perhaps refine the regional planning board concept or find some other method to work towards rural-urban equity in healthcare delivery. Once the study is complete, we can outline a tax structure to finance a universal system that is fair and provides sufficient funding. We can explore incremental steps that are consistent with what we expect will be the nature of a universal system. Among these might be expanding the Oregon prescription drug program to those paying with insurance, or broadening the Oregon Health Plan eligibility. Thank you for the opportunity to testify today,